The new budget bill passed by Congress, described as a major win for President Trump, is likely to have harmful effects on people in every state, particularly those who rely on essential public services like healthcare, housing, and food assistance. Here's a breakdown of how the bill could negatively impact different groups. 1. Impact on people seeking health care. Medicaid cuts. The bill includes deep cuts to Medicaid, the public health program that covers low-income individuals, children, people with disabilities, and seniors. Millions could lose coverage or face reduced benefits. Higher out-of-pocket costs. The bill allows for more flexibility for states to alter health coverage requirements, meaning some could impose higher premiums, deductibles, or co-pays. Pre-existing conditions. While protections for pre-existing conditions remain technically in place, the bill opens pathways for states to weaken them, making coverage harder to afford or access for those with chronic illnesses. 2. Impact on healthcare workers. Job losses. Cuts to Medicaid and other health programs could result in layoffs at hospitals, clinics, and nursing homes, especially in rural areas where facilities often depend heavily on public health funding. Increased pressure. With fewer resources and more uninsured patients, doctors, nurses, and other health professionals will face higher workloads and financial strain on healthcare systems. 3. Impact on public housing. Reduced federal support. The bill slashes funding for housing assistance programs, including subsidies that help low-income families, seniors, and people with disabilities afford safe housing. Increased homelessness risk. With fewer housing vouchers and underfunded public housing programs, more families may face eviction or homelessness, particularly in high-cost cities where affordable housing is already scarce. 4. Impact on food assistance. Cuts to SNAP. The budget reduces funding for the Supplemental Nutrition Assistance Program, which helps millions of low-income families put food on the table. Stricter eligibility rules. The bill introduces tougher work requirements for SNAP recipients, which could disqualify people struggling to find consistent employment, especially in areas with few job opportunities. Reduced access to health care. Fewer affordable housing options, job losses in the health sector, and cuts to food assistance programs will affect millions, deepening inequality and making daily life more difficult for vulnerable communities across all 50 states. Hunger and food insecurity. These cuts will likely lead to more food insecurity, affecting children, seniors, and working families who depend on assistance to avoid hunger. In summary, while supporters of the bill claim it promotes fiscal responsibility and economic growth, the reality for many Americans, especially low-income households, is likely to be increased hardship.